Hey everyone, this is Troy from Cooper Prince. You are watching Let's Talk Local from 216 Creative Studios. If you like this video, please like, share, and subscribe.
Welcome back, everybody. It's Cappuccino here at the table today and not behind the scenes. Hey, listen, if you like what you see here today, go to the old YouTube channel, 216 Creator Studios. Make sure you like, share, subscribe, ding that bell for the future notifications. We appreciate all the support. Here today, we are talking to Dr. Dace over at Precise Chiro here in the McHenry County.
Yeah, Lake in the Hills.
Lake in the Hills.
Yeah.
And you know, we're going to learn a few things today, as my wife calls me at the same time. Isn't that great? You know, I think when it comes to chiropractic, there's a lot of like myth out there, right? People go to doctors, hospitals and their GPs and stuff, and they get, man, my back's been hurting. And so, you know, back in the day, it was like, well, you don't go to chiropractors or witch doctors, right?
Yeah.
And what you don't really realize is your focus as a chiropractor is exactly what their problem is. And so now doctors are even like, you should probably go see a chiropractor. And so, you know, your industry has boomed and you're really helping a lot of people get through some of their pains and sufferings because they certain things they don't even realize. Yeah. So, Doc, one of the first questions I like to ask everybody is, you obviously had a passion to get on your journey to where you're at today. Mm-hmm. What does that look like?
So I started off, I graduated high school. I'm from Wisconsin, Delavan, Lake Geneva area.
Okay.
I graduated high school. I wanted to become a teacher. So I spent 3.5 years going to college to become a teacher. Got into the classroom, and I was like, this is just not for me.
Right. You know, little PTSD later.
The education system, my wife is now a teacher, so sure. I'm not going to say too much things about it, but the education system, like, I want kids to become better people, not just learn
Great answer.
2 + 2 = right? Like, obviously those things are really important, knowing certain basic stuff in schools, but they should also become better people.
Wow. I love that.
And the education system's not revolved around that.
No, unfortunately it's not.
And as soon as I really got into it and realized that really deep, I started to take a look at like, okay, what else am I really passionate about? And my other passion has always been about health, wellness, doing things to not only make myself healthier through certain health problems that I've encountered through my life, like back problems and you know, other issues that I've had throughout my life, but I started chasing that down. So I went back to school, got a degree in exercise science as a bachelor's degree. So I'm one of the only people you'll see that went to undergrad for like over 6 years.
Oh.
And finally got a degree. Usually they're called doctors, but I got a bachelor's.
Right. Or lawyers.
Yeah. And then I went on to, okay, I'm a personal trainer. I have an exercise science degree with the emphasis in recreation, and I'm a minor in coaching. And what do I do with that? And I was like, all right, well, physical therapy is a great route. Occupational therapy is a great route. And then a family friend of mine was like, what about chiropractic?
Yeah.
And I had very limited experience with chiropractic, not really understood it to a very big degree, but I know it helped me when I had back problems. I had a chiropractor that really helped me out with an issue. And I was like, wow, I should really look into that. And I went into a clinic, did a bunch of shadowing, saw how they took care of people. And it was total 180 compared to the medical world, where you go into, you know, your GP say, hey, look, I'm having this issue. My blood pressure's high. He goes, oh, here's a script. Go to the pharmacy.
Yep.
You get no help from them. All you get is a pill. And when you walked into this office, and as you walk into our office now, it is an atmosphere where you're getting help. And it is in depth. It is to the point. It is finding the cause of what's going on with your body, not just fixing the symptom or treating the symptom. It is diving into the root cause of why you're experiencing the symptom in the first place. Because, if we don't fix that, then it's just going to keep coming back and coming back and coming back. And that's where you find these, people in that world that are always on medications because they've never actually delved into the real cause of why they're having the problems in the first place.
Wow. Everything you just said was so right. It's hard. Listen, I got a good doctor, and he's very family friend, and is seriously looking out for my best interests. And that's why I said, when my wife was having some issues with her back, he was like, listen, you need to go see a chiropractor.
Yeah. And that's an awesome thing that's finally starting to come our way in our profession is that, the medical world, there's still a lot of, red tape when it comes to them, when it comes to chiropractic. A lot of them see, that we are, like you said, witch doctors or something like that. But it is starting to come around a little bit more where people are starting to understand that, hey, we do actually help. And hey, we do keep people from taking certain medications and helping them fix their problems without going and having surgeries and having all these medications. So they are coming around to it. And that's really a great thing.
Well, and to the bond, I think, between some of the doctors and the referrals that kind of go back and forth are helpful too. And yeah, there are a lot of, I like calling herding cattle. They get you in, they write you a script or come back for those injections. And then we'll just do a series of that for the rest of your life and run your insurance. 9 times out of 10, and I see that you got a great spine here.
Thanks, I got your back.
Yeah, you got my back. I love it. So you guys study every aspect of the structure between muscle, tissue, deep tissue, bones, spine, and how that all relates and works. And I love it because you're like, high blood pressure, all that stuff can stem from certain things that if you go to a chiropractor for, not only is it the adjustments, most people are like, I'm just going to go get cracked up. Well, no, they're going to not only adjust you, but they're going to set you in your body so it works properly, like a machine.
Yeah.
Right.
Yeah, exactly. I mean, the root cause of not health in what a chiropractor is called dis-ease instead of disease, it's dis-ease, is, the spine and the nervous system is our master system. It controls everything in our body. It makes your lungs breathe. It makes your heart beat. It makes your fingers move. It makes your muscles move. It makes you, pancreas produce insulin. Your nervous system controls everything. And if your nervous system, which being the control of everything in your brain, is not working well via the nerves in your spine, then neither can those things where those nerves go.
Yeah.
Right? That's the biggest thing. 10% of these nerves that come out of the spine and go to organs and tissues and functions and, skin, muscle, all those things, only 10% of that nerve is pain. The rest of that nerve is actually sensory. Sending signals from the brain to the organ, and then nerves going from the organ back to the brain, sending signals back. That's 90% of what our nervous system does.
Wow.
Only 10% of it is to sense pain and what's going on.
That's interesting. It's almost like a roadmap.
Yeah.
Right. And if one's not working properly, you'll start getting what we would consider a side effect of something not working properly.
Right. Well, like you go to the doctor and you say, well, doc, I haven't gone to the bathroom in 3 days.
Yep.
Well, that doctor's going to get you a stool softener and some Miralax and say, see you later. And, don't leave your house for 24 hours, right? Because you're about to have some problems. Right.
Or stop eating glue. I don't know.
Yeah. Right. Whereas I'm like, okay, well, let's look at why. Yeah. And we take an exam and an x-ray and we say that their nerves in their lower back, they've got severe compression on a nerve, especially these L4, L5, which go to the colon. It's like, wow, okay. Well, we adjust them and we get that nerve feeling better, moving better. And it's amazing what happens.
Yeah.
And that's done without taking pills.
One of the big questions that we have asked for chiropractors, especially, my whole family goes to a chiropractor.
Wonderful.
And kids today, they have anxiety issues
Hmm.
and stuff like that. How does that relate?
So there is a lot to unpack there.
Yeah.
It really can have a lot to do with it. I'll start and we'll make it this as easy and kind of, I would say, as basic as possible.
Sure.
Um, Birth is a very traumatic experience for everybody involved,
Hmm.
mother and baby. Sometimes, when the doctor is in there and they're doing their job, they're in there, they're going to use some force to pull the baby out. Well, that can be upwards of, 60 to 80 pounds of force trying to pull that baby out. Imagine what that's doing to their neck
Hmm.
at the same time.
Yeah.
Okay. Studies have been shown that like almost 90% of infants born have a neck subluxation
Really?
that goes unaddressed. Well, what can happen and what does happen is unaddressed issues like that cause stress, especially when we're talking about the upper neck where our brainstem sits. That's where our regulation system is, and where our nerve called the vagus nerve is the one that goes to everything.
That's like starts somewhere along here.
It goes,
doesn't it?
yeah, from your brain, travels right across C1, and it connects all your organs, and it sends that signal to say, hey, we're not in danger. You can take a rest. And rest called rest and digest, or parasympathetic, nervous system. That nerve controls that. Well, if your top bone in your spine is rotated or misaligned, putting pressure on that nerve, that signal never gets going to de-stress. So then what happens when a child grows up in a constant state of stress?
Yeah, interesting. Which pushes fight or flight.
Fight or flight all the time.
Yeah.
Right. And, it's amazing that what happens when we see, especially infants, and it's, colic or something like that. Right. And, mom comes in, oh, they haven't slept in 4 days, but it's crazy. The mom is exhausted. The baby's crying. Okay, cool. Well, I adjust them and the baby's asleep before I even put them back in the car seat.
Wow.
It's like, I just flip that switch.
So let's move up to infant to teenager. Yeah. Right. Mm-hmm. Same scenario. Right now you got years of that. Just building up, and let's just say they're all one piece at this point. They're locked up, they're stressed out, they're constantly clenching, and they come see you. What are some of the first steps that you're looking for, that you go, hey, we got to get it to the Vegas. I love the Vegas nerve because it says Vegas in it. But right, it's how I remember it. I ain't gonna lie. But it's the same scenario, but just older, right? They're all locked up. Their muscles are clenching in.
Well, and you've given them time to cause traumas to their spines. Kids learning how to walk. And my 8-month-old is picking herself up on all kinds of stuff right now, and she's bumping her bottom when she falls and bumping her head. And you imagine a childhood full of that, playing sports, having siblings, getting knocked over. Yeah. What that can do to your spine, right? Yeah. And you get a misalignment in your spine from those little traumas that, hey, you don't feel it right away. You don't usually feel that for 5 to 10 years anyways, because it's our body's really good at taking care of stuff behind the scenes. And then it'll manifest itself in teens or adults. And at that point, I tell people, I'm like, hey, this problem's been there for 10 years. They look at me like, I'm 20 years old. How's that possible? I'm like, well, you probably were wrestling and had a bump and you threw out something and you didn't get it fixed. Yeah. And you didn't have pain because you're a kid and you're able to adapt really well. Well, now that you're an adult, you're not able to adapt really well, and that's now bugging you.
Nico, that explains a lot about me. Like, I'm sure my dad dropped me at least 17 times.
Oh, definitely.
And here I am.
Yeah.
Let's talk about Precise a little bit. So what makes Precise different than any other chiropractor, in your opinion?
Yeah. And I worked at another office before for years before I came to this area and and I'm now at Precise. The office I worked at before was a great office. It focused all around the adjustment, which is by far what the chiropractors do, right? Yeah. We adjust people. But what Precise really focuses on is not the adjustment, but also taking a look at, on this model, I'll show you the disc. The disc here is the red. It performs 2 big main functions for us. It allows our spine to move and bend and twist and rotate.
Yep.
Right? But it also provides a hole for that nerve to exit the spine and go to the organs and functions.
Interesting.
Right?
Yeah.
Well, through those stressors, being a kid, falling, tripping, car accidents, bad posture at school, bad posture sitting over a table.
Like I am right now?
Yeah.
Right.
Yeah, bad posture anytime. All those stressors gets these bones misaligned. Okay? These misalignments now don't let the spine move appropriately because it looks like that now. And when it does that, the disc over time wears and tears, and eventually you get a herniation or a disc bulge.
Yep.
Right?
Oh, yeah.
And that presses on nerve tissue. That is something that separates us from a lot of other chiropractors, is that we deal with a lot of disc issues. And when we see that, our office is very uniquely designed to help heal those and help people avoid disc surgery.
So discs are able to heal.
Yes.
And that, so,
Mhm.
you know, when you hear like I had to get fused discs, is that because they weren't able to heal, or it's just gone so long and it's been so damaged that you get fusions? You had to get fusions done.
Yeah, a lot of times, they get the wrong management done. They go immediately right to an orthopedic,
Yeah.
right? Which, hey, if I didn't know about chiropractic,
Sure.
you know, that
Yeah.
would probably, you know, that'd be a good guess where to go. That orthopedic does one of two things. They give you a pain management, or they'll do a shot. If you got a herniation severe enough, they'll do a shot right into it. That's a steroid shot to see if it'll take away the inflammation.
Okay.
Well, that's not fixing the root cause of the problem, right? The root cause of the problem is that this bone's been misaligned for 10, 15 years, causing wear and tear,
Yeah.
right? That shot, man, it masks the symptoms so you feel better. But when that shot wears away, you're back to where you were. And then they'll do another shot, and then they'll do another shot, and then, 3 shots later, sorry, we can no longer do a shot. Now you're a surgical candidate.
I see. Okay.
Right. And I'm not saying bad things about them.
No,
they're doing what they know to do.
That's what they know.
That's what their protocol.
So this is a lot of preventative maintenance.
Absolutely.
You know,
Yeah.
so it's kind of like, you know, make sure you change the oil in your car. You want to go out and make sure that you're keeping your body aligned, so you don't end up with that final result.
Yeah.
So do you remember we're around the same age, maybe ish. Do you remember being young and then somebody saying, "Don't crack your knuckles"?
Yeah.
You know,
everybody's grandma tells them that.
Right. And if you go to it was always a thing where if you go to a chiropractor, they constantly crack you. It's getting, you're wearing them out. Now it's just going to keep popping out of place because you got to constantly go back. Tell me about that. That's obviously a wives' tale, right?
Yeah, it's a wives' tale, 100%. Yeah. You know, the cracking, the actual physical pop of the joint is nothing but there's a little tiny air bubble inside of all of our joints. It's actually like nitrogen based.
Okay.
When you put a certain pressure into that joint, that bubble kind of real quick and it comes back.
Interesting.
That's why you can crack your knuckles like 50 times a day. And that's
okay.
Fine, right? It doesn't cause arthritis unless you
that was the big thing.
Yeah, unless you over abuse it, right?
Sure.
If you're doing that 100 times a day, well, you are causing some significant
absolutely
possible issues later in life. Everybody's grandma tells them not to do that simply because it's annoying.
Yeah. Well,
when you do that in front of them.
Yeah, my mom. Well, it was my mom. She was always like, "Don't," you know.
Yeah. So they made up that, you know, that wives' tale about that. Hitting that other point of like, you know, it seems like you guys always have to go back to the chiropractor a lot, right? That's something that we always have to fight against too, because like you said, it's maintenance.
Mm-hmm.
It's like getting an oil change on your car. Or else your car.
You go back to the dentist, don't you?
Yeah.
Right.
Exactly. So we go do these things for maintenance and make sure that these issues that we might be dealing with don't come back, for one, and we maintain health and even can get better health over time through maintenance too. Because again, what is our main function as a chiropractor? It's not to take away your pain. It's to make sure your nervous system is working properly.
That's right.
And your nervous system is directing your immune system, is directing your cardiovascular system, is directing your lungs, your muscles, your skin. You know, if the nerves that go to those places aren't functioning, then you're just not going to function.
Well, excuse me. You know, it's funny too. A lot of work that happens today is here, right?
Mm-hmm.
It's a lot of this, and the way you sit, the way you hold your arms, the carpal tunnel, those are the big it's not like if you're an athlete, right? And you're running and you're kicking bags as a martial artist. After a while, that wears out, right? You're
Yeah.
putting a lot of impact on certain things.
Yeah, if you don't take care of it properly.
And so what people don't realize is like, well, I got to go see a doctor because, my fingers are constantly numb, right? The tingling in my fingers.
Yeah.
I get that all the time. I'm not trying to get free advice. Sure I am.
Yeah,
But,
okay.
right. So, your fingers are constantly numb. If you're working above your head for 10 seconds and all of a sudden your hands are numb.
Yeah.
Probably something in chiropractic to go see your
Yeah.
chiropractor, right?
Yeah, absolutely. That's a chiropractic bread and butter. The nerves in your lower neck and your upper back here, the light blue and the darker blue.
Yeah.
Or the purple maybe, I don't know.
Yeah, it's like a pinkish purple maybe.
Yeah. Those lower nerves here, they go out and they go all the way into your hands, all the way to your fingers, right? Well, right now the big thing in any industry is posture, right? With us. Well, your posture, your back is supposed to curve in certain aspects to A, because it's a shock absorber, but B, this is also what your spinal cord is shaped like. Okay. Now, people have bad posture. Forward head posture being one, tech neck, right? Like you said, on computers too much. Well, you start forwarding that posture. Well, what is that going to do to these nerves in that lower part of the neck?
Interesting. Yeah. Every
inch you move your head forward, you're putting 10 pounds of extra compressive force into these nerves.
Well, and is that where the hump starts causing the hump?
Yeah. Everybody's got one of those. Your C7 or your T1 vertebra are the biggest spinous process right here. So everybody has a bump. But if you start forwarding that posture, well, that bump becomes very prevalent. Right? If you kept that neck curve the way it is supposed to be, well, that hump's going to be very limited. You're not going to have that.
Well, and besides the adjustments and what you do to keep the spine correct, you teach like proper stretches to do in order to stay that way.
So in our office, everybody gets a very comprehensive design protocol for them.
Nice.
Everybody's needs are different. Everybody's issues are different, and what their spine looks like is different. So chiropractic's not a cookie cutter thing.
Yeah. Not everybody's the same.
Right. So our office, we give everybody, their plan with chiropractic and maybe decompression if that's warranted. If their posture is really bad, maybe it's a spinal orthotic to help grow the curve again, or not grow, but heal the curve. But that is also going to be in tandem with with spinal rehab that we have, what we do at our office as well.
Nice. Specialty therapies you guys do. There was something about is it an ultrasound gun or?
So it's SoftWave technology.
SoftWave. Thank you.
Yep. SoftWave tissue regenerative technology. Yeah. We have that in our office. It's a really, really wonderful piece of equipment that helps with soft tissue injuries, such as knee issues, shoulder issues, some back issues. We'll use that on as well if there's, really damaged tissue, right? You hurt your knee, you've got a sprained MCL, ACL, meniscus, right? It's common, super common in knee injuries.
Yep.
Well, instead of going and getting a shot and surgery and all that stuff, you can get SoftWave done, which has been proven through scientific literature to help regenerate those tissues and heal your body naturally.
Interesting.
Right.
Does that go as far as anything from plantar fasciitis all the way to, or is it just specifically for those kind of like an injury?
No, it can be used for a lot of different things. Yeah.
I know that machine's not cheap.
No.
Right.
No. It can be used for a lot of different things. One of its key features is that it takes away inflammation. So plantar fasciitis, tendinitis is, anything that ends in itis is an inflammation term in our medical world. So any itis is inflammation. So that means, we can be used for very versatile things. That, what it does is it tells your body to produce stem cells. Stem cells are the body's neutral cells, is what I like to call them. They aren't programmed to be anything yet. just like a computer, like you have to program it, right? Well, your body programs these cells to become liver, become skin,
Got you.
become
That's why
that.
stem cell research was such a big thing, right?
Yes.
It's like if you
So
end up
these
with a
are
disease or
basically
something.
blank cells,
Got you.
and this machine tells your body to make them and focus them into that area.
Nice.
So if it's a knee, well, you make more stem cells, it sends them to the knee. It's set to do that. What it also does is it creates more red blood cells to the area, more blood vessels. Sorry, excuse me. After a course of treatment, it's been studied and proven to have over like 200% more blood vessels in that area.
Wow.
More blood vessels, more healing opportunity. You know, you get that fluid exchange of inflammation and stuff like that, and you can heal things a lot faster.
Wow.
So that machine does a lot of good things.
I would have to say, yeah. I mean, you're not just pulling that out on every single person that walks in there, obviously, but when you get through your analysis on a individual person, everybody's got their own profile and what needs to be done. And then if certain things keep occurring, or you're like, hey, do we need to bring out the big machine? Right. Is that kind of how
and
that
we'll
works?
do that with certain people. They'll call us and they say, hey, you know, my knee's just tough.
Yeah.
So, you know, we might not do chiropractic on them. We'll just focus on the knee and do SoftWave.
Okay.
And say like, okay, well, we do this specific orthopedic test that says that your MCL ligament is either sprained, strained, or torn. And well, let's do the SoftWave and help that get better.
Yeah. Nice.
Yeah.
Nice. So, and you've been with them for how long?
I've actually been with them since beginning of April
Well,
this year, 2025.
So pretty fresh in.
Pretty
right?
fresh in.
Yeah, nice.
Yeah.
Very knowledgeable that you are. You obviously did all your homework. You went to all the right schools.
Yeah.
You know, I love your personality, by the way. You're not just like, let's talk about your body and it's going to be so dry. And you have a personality to where
That's good.
sometimes I go to places and it's just like, I'm sorry, what were you saying? Because I couldn't fall to sleep. You explain things very well too.
Communication is key. And if the patients don't understand what's going on with them, then they won't understand what it takes to get them better.
Yeah.
And that's, you know, why we've got to explain things a certain way. It's almost like, yeah, we know a ton of the big fancy words for medical doctors and stuff like that, but we don't need to talk about it that way.
Well, no, you know what's cool too is you build these relationships with your patients, and they're not just a number to you.
No.
And that's what so you and I met at a gym actually.
Yeah.
And we just started having a conversation. What really raised my eyebrows to the whole thing is, you know, your biggest thing was the patient. It wasn't about the money, wasn't about anything else. It was about how do I help these people that need the help?
Yeah.
And your focus is on them and they walk in, they know you by name. It's a relationship that you built with them. That's why I think, you know, Precise Chiro is a great place to go to here local. And so what's the best way for them to get a hold of you?
Best way to get a hold of us is go to our website, precisechiro.com, or give us a call at 847-669-6888.
Yep. And we got it right there on the screen. Fantastic.
Yeah.
And also, folks, in the description, feel free to click that link. It'll take you right to him. Where are you exactly located?
So we're located on the corner of Lakewood and Ackman.
Okay. Yep.
You'll see like Crandall's Bakeries right on the corner there. So,
oh yeah, been in there a couple times.
If you were to take a left on Ackman there, or on Lakewood there, we are the next plaza.
Oh, okay.
Yeah.
Yeah. Okay.
Next I know exactly Elite Laser and Coco's Pet Spa.
Yeah. And you know, to come in and have a conversation, what does that cost?
So, if you say you found me on the podcast, as long as, you know, federal regulations aren't in order for like Medicare, Medicaid, and like, and those things, that this doesn't apply to them. But it'd be $47 to come talk to me and have a consultation.
Oh, fantastic.
And that'll also include any necessary x-rays, and also if I can help you, my best recommendations. Oh,
fantastic. Listen, folks, go ahead and mention Let's Talk Local here at 216 Creator Studios. Obviously that will be the promo code when you walk in. And go talk to Dr. Tom. You know, I think too, in this area, especially, I've noticed that the market's flooded with all kinds of chiropractors, a lot of competition, obviously, out
Mhm.
there. But don't be fooled, folks. You want to find the right who that knows the how that's going to be a fit for you. Precise Chiropractic, I think, is probably a great way to
Yeah.
go, you
And
know.
what I always tell people is, it's similar to like dentistry. Some people have had a bad experience at a chiropractor,
Sure.
and that is okay. We've all had a bad dentist as well.
Yep.
I mean, you didn't go and swear off dentistry and never get your teeth checked again.
True.
You just went and found a different dentist.
That's 100% true.
Right. So chiropractic is an extremely part of anybody's wellness and health. It's like they said, the nervous system is the most important function of the body. If it is not working properly, then neither are you. And if you have had a bad experience at a chiropractor, I'm very sorry about that, for one, but that does not mean you're going to get a bad experience everywhere you go.
Correct. One of the biggest things. So when I was younger, right after my first was born, my wife was laid up for over a year on a couch. Couldn't lower back, really bad. Sports medicine, and then the shots, and it was just progressively getting worse. And my wife's an athlete. She used to be soccer, martial arts, and softball, and pitcher catcher, always up and down,
Yeah.
and so it destroyed her, and because we didn't know, my father kept saying, you got to go see my gal. That's what he said. So, okay, you got to go see my gal. She knows what she's doing as a chiropractor. I was like, always heard chiropractors, So I was like, okay. I said, you know what? We'll try anything at this point. This older woman, she's not in business anymore, but she was awesome. Her name was Christine. She had my wife back at the gym in 2 weeks after a year of laying on the couch. And she explained to her, she's like, listen, your lower back is a birth defect on your lower plates, doesn't know what's top or bottom. So you got some issues down there that you need to strengthen your core for. And after your birth, it was a C-section birth, but my wife sat in labor for like 46 hours.
Yeah.
And then
That's
someone
rough.
said, this baby's 8 pounds. It's not coming out that way. What are we doing?
Yeah.
So she was like, oh my God, the epidural shoved in her back. And, so it was crazy, but I was instantly like, if it's witchcraft, call me Harry Potter, because I'm in.
Yeah.
Then, so I've been going ever since, and my kids, they go.
Yeah.
And you know what? We feel great. So it's definitely well worth it. And if we got the 5-minute marker. So yeah, I'm coming up on the back end of this. It's well worth getting looked at. If you feel if you don't even know that you need one really most of the time, but just as if you have a dentist or a doctor, or go see you and say, hey, I want to be looked at, and say, you let me know where I'm at. As we get older, we start realizing we have more ailments, right?
Yep.
And so, a good time is before you decide to jump into all kinds of traditional, surgeries and medicines, go see the chiropractor.
Yeah. And, I'll kind of touch base on this is like, I've helped a lot of people, and the best way to help is come get an evaluation. If you're just somebody interested in wellness and you just want to be a healthier person and avoid medications, we got it.
Yeah.
If you want to avoid a surgery, our clinic has over a 90% success rate with people avoiding spinal surgeries.
Wow.
For disc issues.
Yeah.
It's really remarkable stuff that we're able to do. So it's worth it, whether it's on a wellness spectrum and you're just like, hey, I want to get my spine checked because it is important. If you're an athlete, it's tremendously important. I couldn't tell you how many even young kids have bad posture, which is going to affect them later in life if they don't get addressed.
Yep.
Or, anywhere from older people that don't have their range of motion anymore because they think that they're in trouble and they've got arthritis and stuff. And it's like, no, we can help with that.
Yeah,
we really can. It's not, it's not witchcraft. It's
right.
I tell all
it's
my
science.
Yeah. I tell all my patients that I don't treat anything. I put the body in alignment so your body can heal itself.
Yeah.
Because the body's got all the tools to do it.
Yep.
The body knows what to do. The body's smarter than We all know
It's
it. Yeah.
designed to do everything
Yeah.
it needs to do, right?
Yeah,
I mean,
exactly. So I don't fix anything.
Yeah.
I put the body in a state of place that it can heal itself. And
I
it's
love it.
it's amazing what can happen. It's magic.
Awesome.
Yeah.
That's awesome. Thanks for coming in today.
Yeah.
And we love it. Check them out once again, guys. In the description below, Dr. Dace. We appreciate you coming in. PreciseChiro.com. And you know, it never hurts to go get checked out. It only hurts not to.
Yes.
You know,
Yep.
they're there to ease the pain.
There's no time like the present.
That's correct. That's correct. And he's got your back. Absolutely. Until next time, guys. Hey, listen, let's talk local. Listen global.